nurse strike.
Hi, I'm Freya. I'm a second year children's nursing student, and I'm going to be talking primarily about the nursing strikes. So, as I'm sure everyone here is aware, nurses, amongst many other professions, not just localised to healthcare, are taking strike action at the moment. Within nursing, strike action is not just over pay disputes, despite what lots of sort of news headlines are going to be saying. And whilst pay is a big factor, it's striking is happening because of chronic understaffing and underfunding of the National Health Service. So what we're currently facing as nurses is a lack of resources, not enough beds, not enough staff to look after the patients in those beds, high levels of staff burnout, and record-breaking numbers of staff leaving. And like Tash said with the doctors, this is either leaving the country to work in Australia or Dubai or America, and also leaving NHS hospitals to work in private hospitals, or leaving healthcare altogether. Lots of staff members are leaving because they physically cannot do the job that they signed up to do. They don't have the resources or the funding or the support to actually give the level of care that they want to give and that they're trained to give. So they're leaving because they're not in the career that they wanted to be in. And this is contributing to poorer patient outcomes, increased mortality rates within hospitals, low staff morale, increased numbers of poor mental health, and suicidality amongst staff. And that's not the striking that's causing this. We're striking because of that. The striking is not increasing mortality rates in hospital. The striking is not increasing poor mental health among staff. Staff are striking because of those characteristics. And again, as Tash said, there has not been evidence to show that patients have been subject to significant harm as a result of strikes, but they are subjected to significant harm due to the current state of the National Health Service and public sector organisations. Next slide, please. So the current situation as it stands, and this is changing pretty much daily, but governments in Scotland and Wales have been negotiating with members of the Royal College of Nursing. This negotiation hasn't necessarily been to agree to the sort of proposed deals that the Royal College of Nursing set out for, but the government has been cooperating with RCN officials. As of yet, the English government have not made any attempt to converse with the Royal College of Nursing, or they have rejected all opportunities to consider or negotiate a inflation-related pay increases, and sort of refused to touch on the topic whatsoever, other than saying that they can't afford to give nurses a pay rise. Additionally, when public appearances to hospitals have been made by sort of government officials, higher ups in sort of hospitals has sort of rolled out the red carpets for them, and everything's looked sort of pristine and perfect. And that's just not painting an accurate picture of what it's like in the NHS at the moment. So striking is happening so that we can show them what we're faced with at the moment. And unfortunately, that's just not getting across when they make visits to hospitals and sort of everything's perfect. And that is that's certainly not the case that all of us find when we go into work every day. The plan off the back of COVID was from, I believe, 2 cohorts ago, so 2 university cohorts ago, was to start rolling out 50,000 new nurses in the next 5 years. So we've done 2 of those cohorts. The UCAS deadline for the 3rd cohort has just ended, and it's been shown that there's been a decrease by 19% of people applying to any of the 4 fields of nursing. That 19% decline is a direct result of what healthcare currently looks like for staff and for patients. We just don't have the people wanting to go into healthcare at the moment because of what we're being faced with. And don't get me wrong, I love my job, but loving it isn't enough. And that's not enough to churn out 50,000 new nurses. And it decreased by 19% this year. What's that going to be next year? You know, like, is it actually achievable to have 50,000 new trained nurses within the next few years when the government aren't sort of trying to negotiate any improvements in the current staffing situations? And the main priority of the striking is to keep our patients safe. That is everything that we are doing. It comes from the centre of wanting to protect our patients and keep our patients safe and improve their quality of life. And I see that from a nurse's perspective. I also see that from a patient's perspective. And the nursing strikes, along with the physio strikes, the dietitians, the healthcare assistants, the doctors, like, I cannot stress this enough when I say we all deserve better. And hopefully, I hope, like with everything in me, that we will get better and that our voices will be heard. But strike action is happening because we've reached a point where we have no other option. And I'd like to say the only way is up from here. I think I'm going to pass over to Emily now.